It's been a tough season with lots of viruses making people sick.
Thankfully, Santa and I are feeling as healthy as ever. We are both up to date with our vaccinations, including COVID boosters and flu shots.
Earlier this morning, the National Advisory Committee on Immunization published their initial considerations for future COVID-19 booster doses for 2023. I thank NACI for their guidance. This is a good reminder that if you have not received a bivalent booster this fall or winter, it's not too late to get one and get better protected. Boosters remain one of our best defenses against the severe outcomes of COVID-19.
Mr. Bourla, can I ask you, when did you know that the vaccines didn't stop? How long did you know that without saying it publicly?
Thank you very much.
I'm sorry. Answer that question.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
In protecting both yourself, your family, and your community. We are now actively working with Health Canada and will continue to work with the Public Health Agency of Canada to make sure that Canada has a single internationally recognized vaccine passport that includes the recognition of these combinations.
Well, none of that was true, as it turns out, and based on that lie, all of the mandates, all of the lockdowns, all of the non-pharmaceutical measures at home, curfews, all of that was based on that gigantic lie.
We also need to protect the overburdened healthcare workers by doing everything we can to stay healthy.
You've been unbelievably busy as frontline heroes, not to say it too many times.
In BC, healthcare providers are facing a pandemic, an opioid crisis, and a staffing crisis that long predates both. Now, healthcare workers in BC are being told to get a vaccine, but the BC Nurses Union says that may lead to losing even more nurses. Health officials say 80% of nurses are vaccinated. That means of the current 48,000 nurses in BC, 9,600 are unvaccinated. And losing them, the Nurses Union says, may crash the system.
It would cripple healthcare in BC.
We're going to have to prepare for circumstances should people leave certain positions.
I thank Canadians for contributing to this effort by staying up to date on their vaccinations and continuing to practice individual public health measures, such as wearing a tight-fitting, well-constructed mask and staying home if sick. Earlier last fall, parents and caregivers were particularly concerned about their difficulty to find children's analgesics. As of today, 3.8 million additional bottles of these medicines have been made available to parents and caregivers through increased domestic supply and foreign importation. I also wish to inform parents and caregivers that a major pharmaceutical company, Alon, estimates that an additional 1.1 million bottles will be available at pharmacies and retailers across Canada for the month of January. This is very encouraging news, as we are starting to see some good signals that the overall pediatric analgesic supply situation is starting to improve. We will obviously continue to work very closely with all our partners, including manufacturers and provinces and territories, to address these shortages both in the short and in the longer term. I would be remiss if I didn't give a short update on the discussions taking place between the Canadian government and the provinces and territories on healthcare investments. These discussions continue collaboratively in the best interest of patients and healthcare workers. 5 fundamental areas of shared priorities are our common focus: reducing backlogs and supporting our health workers, enhancing access to family health services, improving mental health services, helping Canadians age in dignity, and modernizing our healthcare system, in part through a better use of data to save lives and increase the quality of care to Canadians. As the Prime Minister has said, we are confident that we're going to get to a good place.
80% of Canadians were stepping up to do the right thing, not just for themselves, but for their neighbors.
No.
There were people out there trying to scare people into putting their own lives at risk and their communities at risk.
You deserve better. You deserve a government that's going to continue to say, get vaccinated. And you know what? If you don't want to get vaccinated, that's your choice. But don't think you can get on a plane or a train besides vaccinated people and put them at risk.
My job to keep Canadians safe involves following the science, following the best expertise of our public health officials, of our doctors.
I'm personally very optimistic, and I'm looking forward to significant and positive developments in the weeks ahead.
Welcome to our first update of 2023. I hope that everyone had an enjoyable holiday season.
Canada is a strong and proud member of the Five Eyes Alliance between Canada, the United States, Great Britain, New Zealand, and Australia. And we do a tremendous amount of information sharing and security work together.
Well, here we are, the end of 2022, and we've had over 10 million cases of COVID. The Australian Health Department, of course, stopped counting around September sometime because I think it was getting too embarrassing to admit that despite with over 20 million people being vaccinated, over half the country had caught COVID. Whatever happened to protecting you? Whatever happened to protecting you? But we don't want to talk about that anymore. We'll just pull it off the website and not discuss it.
Public health activities have raised everyone's awareness of healthy habits and ways of living. Let's capitalize on that and focus on preparedness for future public health events, including protecting ourselves from COVID-19 and other circulating respiratory viruses. The latest data indicates that COVID-19 activity continues to fluctuate across the country, while both influenza and RSV have settled into expected seasonal levels.
Hey, it's Marcel with Irnieracing. I'm going to show you the annual influenza reports coming out of Canada. This is Canada.ca's, their own website. And you can tell me if something is askew. We can't mention this on CensorTube. So there's the website. You can go there yourself, Canada.ca, Public Health Services, Disease, Flu, Influenza, Surveillance. It's the influenza surveillance. Note on the annual reports, for some reason, the 17 to 18 and so forth have been removed from the website. So they're only giving you the annual reports now of the last 3 seasons. And I've been here a year ago and they used to be there. But let's just take a look anyways and I'll show you. Okay, so here we have 21 and 20. 21 and 20, only 69 positive detections of influenza reported. So there is no influenza in 20 to 21. Now, if that doesn't tell you something right off the bat, or like, so influenza's been around for all of time that I've been aware, and we've never eradicated influenza in the past, and we're not going to do it today. There's no way influenza is disappearing. Now let's look at the year before. Here's 19 and 20. How many? 55,379. So why would only 69 be in 2021? Again, we can't talk about this on CensorTube. It's pretty obvious. It's like, what do you label? You know, what do you label something? Well, it's being labeled something else, right? It's not being labeled as influenza. It's being labeled as something else that I can't mention. Again, 55,000. Now let's go back another season. 2018, 2019, 48,818. Again, how many did we say here? 69, guys, 69 during the bullshit season. Okay. Now, remember how I told you that the annual reports only went back here, but you can actually find the weekly reports. So here is a weekly report. See up here it says 17, 18, week 30 to 34. But I found in that is this season, this would be is 64,403. So we're getting a 17-18 annual report here at this point of week 34 into their setup. So boom, 64,000. Now I went back again, and for 16 and 17, I haven't found an add up yet, but you could do it yourself. But as an example, you click on week 34, you know, and you're gonna get like you're gonna get individual numbers. And I'm just gonna look for it. So that I found one in 19. Where are we looking for? In week 8, the number of positive tests was 2,337. So in 1 week, 2,000. And again, let's go back to 21 during bullshit era, 69. There you go. How obvious is the deceit? What are you gonna call something and label it? Well, you're gonna make some shit up. So anyways, guys, hopefully my point is made. This is Irnieracing. Let's get back to the bullshit speech by the Canadian government and telling us to get more boosters.
However, the healthcare sector is still recovering from the pressures of these viruses in our population. For this reason, it is still important to do everything we can to prevent severe illness. In its statement released today, the National Advisory Committee on Immunization, or NACI, reminds us that booster doses of COVID-19 vaccine are an effective tool to reduce the risk of severe illness and death. Taking measures that reduce the likelihood of hospitalization remains important for all of us, since it subsequently affects health system capacity. If a full booster was recommended for you and you haven't got it yet, now is a good time to get a bivalent booster. As we continue to monitor national and international data, including COVID-19 disease rates, but also contextual information like the level of immunity in the population, we are seeing an increase in the proportion of sequence detections associated with the XBB.1.5 variant. Through whole genome sequencing of clinical specimens, XBB.1.5 is known to have been circulating in Canada at 2.5% during the week of December the 25th to January the 2nd. This proportion is projected to rise to approximately 7% in Canada by mid-January. While XBB variants are expected to increase in Canada, it is not known whether they will become the dominant lineage.
There you have it, Canada's doggy doctor giving propaganda, trying to fear-monger the Canadians into getting more boosters. Let's go back to the beginning. Everybody's forgetting about what happened to that Wuhan lab. What happened? Where did it come from? Why hasn't it been isolated, etc.? So I just want to remind everybody that gain of function research was banned in the USA. So they're not allowed to practice gain of function research in the USA. Now they were doing this for, decades before the ban. But what do they do when the ban is created? Well, they just outsource the entire project to other countries, such as Ukraine, such as the Wuhan in China. So the Wuhan lab is funded by the USA and instigated by Fauci. Anthony Fauci is at the top of that pyramid with the gain of function research for these past decades. He's that evil villain, in like Inspector Gadget, the guy with the cat, with Coco the cat. That is Fauci, and he should be held responsible and go to court, and we'd like to see that. Irnieracing.
Nationally, the absolute number of cases is not surging at this time, nor is there evidence of increased severity with this or other new variants. In 2022, the Omicron variant resulted in the highest numbers of infections in Canada to date. Fortunately, over time, there has been a general trend towards decreased severe outcomes, such as critical care admissions and deaths among hospitalized patients. This may reflect the impact of vaccines and infection-induced immunity, changes in the characteristics of the people infected, and changes in circulating strains. Like the winter weather, It can be difficult to predict exactly what we're going to see next, but we do know it's too early to put away our winter coats and boots. Similarly, it's still too early to stop taking the personal protective measures that have helped us weather the COVID storm.
Are you worried about product liability? Are you worried about... What about... What do you have to say about young men dropping dead of heart attacks every day? Why won't you answer these basic questions?
At this time of New Year resolutions, public health remains resolute in our commitment to fostering health within our populations by promoting health, preventing disease, illness, and injury to achieve optimal health and well-being for all people living in Canada. Happy and safe Lunar New Year to those who celebrate. Thank you. Merci. Miigwech.
Next question is Tom Perry, CBC.
Hi, Minister. I'd just like to get that in English. How close do you think you are to a deal with the provinces? And also, if you get a deal overall with the provinces, do you see yourself pursuing bilateral deals with individual provinces and territories on specific points?
First, I would like to recognize that there has been significant progress over the last few weeks. I'm positive and optimistic, as the Prime Minister is also, as he has signaled earlier this week. And that's because we have seen a shift towards a focus on what matters to Canadians, which are results.
My responsibility as a Prime Minister is stand up for people's safety, people's well-being in this country. That's what I did during the pandemic.
No.
I took some tough decisions to make sure that people were able to stay safe, they were able to hang on to their jobs, they were able to make sure we're not overwhelming our healthcare systems and protecting those frontline heroes by getting vaccinated.
The World Health Organization is supposed to be meeting again next week to look at whether to lift the COVID-19 related public health emergency of international concern. If they do that, what impact is that going to have here in Canada?
Yes, so that's an important deliberation next week. And of course, we are 3 years from the initial emergence of the virus or the reporting of the virus. In Canada, we're already doing what we need to do, I think. And in the upcoming year, we need to continue to monitor the evolution of the virus, the Omicron variant, because it's still spreading quite a bit all over the world, is going to undergo its mutations. I think we are seeing that in real time. Well, kids, I'm just doing my yearly call to the North Pole for Santa's holiday health check.
Why, hello, Dr. Tam.
Mrs. Claus, so good to see you again. Where did Santa go?
Oh, Santa was late for snow yoga with the elves and reindeer. He says it's great cross-training for sleigh driving.
Sounds fun. Are you all set for the holiday season?
Of course. I must say, Dr. Tam, it just warms my heart to see everyone in Canada, especially kids, working so hard to keep the holidays safe and cheerful for all.
So am I, Mrs. Claus. Every child in Canada has definitely earned a place on the nice list. Their parents and caregivers too. It's been a tough season with lots of viruses making people sick.
Thankfully, Santa and I are feeling as healthy as ever. We are both up to date with our vaccinations, including COVID boosters and flu shots.
That's so good to hear.
I always tell Santa to make a list and check it twice. 1, stay up to date on your vaccinations. 2, wear a mask in crowded indoor places and make sure it fits nice and snug.
Monitoring that is very important because it's likely to increase its immune evasion properties, and we may have to adjust things like vaccine formulation. So that's why it's important to continue to monitor the virus itself, and of course any very unusual variants that might pop up. So that's really important. And as the National Advisory Committee on Immunization today in their statement, reinforcing that if you haven't had a full booster with the bivalent vaccine, go get it now. We still have a ways to go, even for the 65 plus population. about half of them haven't received a full booster. So there's some work to do. And that will sort of put us into relatively good position moving forwards. And we need to, of course, have ongoing evaluation and figure out what we're going to do for the next fall. So I think certainly continue.
Next question, Glenn McGregor, CTV.
Both Premiers Ford and Legault have now indicated they're willing to participate in some kind of data sharing arrangement with the federal government on metrics for their performance of their healthcare systems. That we were led to believe was a key stumbling block to the negotiation so far. What are the remaining impediments, and are there other provinces that haven't agreed to that is causing delays in getting this deal done?
I believe most people now recognize the importance of data to save lives.
No.
In COVID-19, we could have saved more lives if workers, healthcare workers, had had better access to data and information on people's health and on the system in general. And therefore, that conversation is around how to protect the lives of people and how to improve the quality of care given to people. That's what the Prime Minister is signaling when he says that he wants a better and a more modern health data system, in part to support the effort that the Government of Canada must keep improving and enhancing in supporting provinces and territories in all of these long-term challenges that we know are impacting our healthcare system and our healthcare workers.
Do you see what he's pointing at here? He's talking about the future digital ID, digital healthcare system, where you are a digital number and you can be turned off if you don't abide, and then you won't have any healthcare. We need to get rid of full government healthcare control. The Trudeau puppets of the world.
So I wouldn't be surprised if our premiers admitted that openly in the near future, because all of my colleagues, health ministers, know that really well. We've spent a considerable time in the last year with the leadership of some key provincial health ministers to work on that file, the modernization of our healthcare system, including a more modern health data system.
The NDP this week said that no more federal money should flow to the provinces for healthcare if there is privatization, further privatization in the system. Ontario, as you know, is going to start outsourcing more surgery, starting with cataracts and moving on to others as well. Will this be a condition of any increase to the health transfers to the provinces, is adherence with the Canada Health Act and limitation on further privatization of delivery of services, not just payment?
We all have different roles in this country around healthcare. We have the common responsibility of upholding the obligations of the Canada Health Act. The good news is that everyone recognizes that responsibility of upholding those obligations, and everyone admits that openly. So you've heard that in the recent days. Now, we need to maintain public funding. We need to make sure that our healthcare system is equitably accessible to everyone, regardless of where that person may live and regardless of that person's income or financial ability to pay for services. Now, there are ways for the federal government to make sure that this is done. Now, there are penalties that can be imposed, that have been imposed, that will be imposed probably in the future when those obligations are not upheld by provinces and territories.
I must tell you, I believe that Alberta Health Services is the source of a lot of the problems that we've had. They signed some kind of a partnership with the World Economic Forum right in the middle of the pandemic. We've got to address that. Why in the world do we have anything to do with the World Economic Forum? That's got to end.
Yeah, good morning. Minister Duclos, you keep talking about data and wanting to modernize data, but we haven't heard a lot about what's missing. What exactly is missing in the data that would help improve health outcomes that we don't have now? And what do we need to do to improve that?
Well, thank you. Let me give you two numbers, 35% in both cases. 35% is the current percentage of healthcare professionals that can work together by sharing data on the health of a patient. That's only 1/3 of healthcare professionals that can work on the same health information that matters for that patient. About 35% is also the number of people who have access to their electronic medical records. That's a very low number because people know that they need that information to better care for their health. In some cases, this information is needed to care for the health of an elderly person, your parent, your spouse. If you don't have access to your electronic medical record, it's more difficult for you to care for your own health or for the health of your loved ones. And as I mentioned, if pharmacists, lab technicians, general practitioners, specialist physicians, if they can't share data on a patient, then it makes it very difficult for them to provide safe care and adequate care to their patients. So in Canada, we are lagging behind in the quality and the availability of data that healthcare workers, pharmacists sometimes find their work quite hard too.
All right, I'm gonna make this video for you because I had to video it so that you'll believe me, because frankly, I didn't believe it myself. So here's a brand new, sealed, perfectly sealed, brand new box of the J&J vaccine. You can see here, I'm going to break this open, and perfectly on top is this perfectly normal package insert. A lot of safety and efficacy data. In fact, all of the normal information that we would find in a package insert, like the ingredients, that would all be found right here in this package insert. Must be magic. It's all blank. The whole thing. Except for this part. That's the only thing not blank. Are you kidding me?
Faxes are still used to share prescription information between prescribers, pharmacists, and therefore that again generates concerns about the safety and the appropriateness of drug medication for the patients that go to see a pharmacist. So there's lots of improvement that we can do. The great news is that some provinces are slightly ahead of others. Great news also is that we have the technology to improve our data system in Canada. Never mind also the important value of data to improve information on the efficiency of treatments, surgeries, drugs.
You said it was 100% effective, then 90%, then 80%, then 70%. But we now know that the transmission. Why did you keep that secret?
Have a nice day.
I won't have a nice day until I know the answer. Why did you keep it a secret that your vaccine did not stop?
Is it time to apologise to the world, sir? To give refunds back to the countries that poured all their money into your vaccine that does?
Yeah, you have a little bit around.
Are you not ashamed of what you've done in the last couple of years?
Do you have any apologies to the public, sir?
So there's a lot of good things we can do looking forward, because we have all the technology and all the goodwill that we need to make that progress in Canada.
Let's start with the fact that he added $100 billion of debt before the very first COVID case was ever discovered here in Canada. He can't blame COVID for that. In fact, he blew through his promise that the deficit would never exceed $10 billion. Well, it was already $100 billion in total before the first case of COVID. Then when COVID came, 40% of all the new spending measures had nothing to do with COVID, according to the Prime Minister's own named parliamentary budget officer. $200 billion of spending unrelated to COVID. And even amongst the COVID spending was an all-you-can-eat buffet of waste and mismanagement. They sent CERB checks to prisoners. They sent them to public servants who were simultaneously drawing public salaries. They gave wage subsidies to wealthy corporations that were rich enough to pay out dividends and bonuses to their executives, even after I warned that they should ban that hideous practice. They tried to give $500 million to the We Charity, an organization that had given $500,000 to the Prime Minister's own family. They spent $54 million on an app we didn't need, that didn't work, and that could have been designed in a weekend for 250 grand. The previous Conservative government had successfully delivered apps that were actually necessary and useful of a similar complexity for $200,000 or $300,000, but somehow this one went to $54 million. Many of the recipients admit they didn't do any work. They just hired other people to do work. So they gave the money to people who didn't do anything other than delegate the work to someone else. Don't we have public servants getting paid within the government to deliver those sorts of contracting? And now the government won't even tell us all of the identity of the recipients of that money. Yeah. So don't tell me they had to double the size of the national debt. Don't tell me that every dollar of inflationary spending was necessary. They were irresponsible and they were unnecessarily profligate with the dollars of Canadians, and now people are paying the price.
That's right. Yeah. Are you proud of it? You've made millions on the backs of people's entire livelihoods. How does that feel to walk the streets as a millionaire on the backs of the regular person at home in Australia, in England, in Canada?
What do you think about on your yacht, sir? What do you think about on your private jet? Are you worried about product liability? Are you worried about...
What about...
What do you have to say about young men dropping dead of heart attacks every day? Why won't you answer these basic questions?